and hello to everyone who's listening to us this evening. So yes, before I tell what mental health is, I always like to start by telling us what health is. And health is, according to the WHO, not just the absence of disease or infirmity, but a complete state of physical, mental, and social well-being. So very often when you hear people say, oh, I haven't been ill for the past 10 years, I haven't been ill for the past 20 years, it means that I'm well. I beg to differ, because the WHO says that you must be well physically, mentally, and socially. And with that, it would be nice to then discuss what mental health is. And we often say that everyone has mental health. And mental health is then the ability to successfully perform the functions of thoughts, emotion, cognition, perception, and other parts of behavior. So if you think about it well, everything I have said emanates from one part of the body, and that is the brain. So being able to successfully perform the functions of cognition, thoughts, emotions, perception, and other aspects of behavior in such a way that the individual is then able to be productive, 1, cope with the normal stresses of life, 2, contribute their own quota to the environment they live in, and last but not the least, have thriving relationships with people around them. Once an individual is able to successfully perform the functions of thoughts, emotion, cognition, perception, and behavior, and they can then achieve those 4 things that I just said, you can say that that individual is mentally healthy or mentally well.
Okay. So now that you've explained to us what mental health is, in your years of practice, like I said earlier, we'll try and narrow this conversation to women. We know that it's not gender-based. We know everybody can suffer from this disorder, but we'll try and narrow the conversation to women. Now, in your years of practice, before I go into that, can you please highlight the mental health disorders that we have?
Okay, so
go ahead to now tell me the ones that you've experienced more in your year.
Okay, well, so if I had to run through the mental health things, I'll be going through the psychiatry Bible, which is called the ICD-10, from cover to cover. I will try. And well, so you have disorders of organic disorders, so we call them disorders of emanating from like the brain. So you have things like dementia, you have delirium, you have disorders of psychotic disorders, you have schizophrenia, you have delusional disorders, you have personality disorders. And personality disorders are a myriad, they're like 9. So you can have schizoid personality disorder, paranoid personality disorders, schizotypal, obsessive compulsive, narcissistic, histrionic, a lot personality disorders. And then when you then leave that, you can then move on to substance abuse disorders. And in substance abuse disorders, depending on what substance is taken and what exactly the individual is, going through. Because so, for instance, some people have substance disorders and it's harmful use. Some people have substance disorders and it's dependence, meaning what the layman on the street will call addiction. Some people have substance disorders which have then caused major mental health disorders. So you can have, so for instance, we usually categorize it as a mental and behavioral disorder, dependent syndrome, for instance, due to cannabinoid use, which is the use of cannabis. I think it's important to highlight that, because many times, people say that, oh, just because their relative is using substance does not mean he has a mental disorder. But for you to have even thought about bringing them to the hospital in the first place is because they have problems with their behavior. So substance use disorders are categorized as mental disorders. Then if you go on from there, of course, you have the mood disorders. And that's very important, because everyone has a mood and everyone's mood can be affected. And that's where you would have, depression, hypomania, you'd have mania itself. And then you then have anxiety disorders. And anxiety is also, it's a normal response to a threat. But of course, it becomes a disorder when it affects functioning in terms of personal functioning in relationships, and occupational functioning. So there are also anxiety disorders. And then you
Okay.
have disorders of scholastic ability. So we're moving from like the adults to the children now. And then in children, you can also have pervasive developmental disorders. So that's where you have things like autism. And even under autism, you have quite a lot of
Of
types of
disorder.
autism. So if
Even
I
from
wanted
what
to make it brief, that's what I would
yeah.
say.
Yeah. Okay. So in your years of practice, like I said earlier, which are the most common for women?
Okay, good. So since we're narrowing down to women, I would say that the commonest disorders in women are mood disorders.
Okay.
And it's not unusual that mood disorders are common in women. Aside mood disorders, you also have anxiety disorders. You have disorders relating to childbirth and the postpartum period.
Okay.
You even have disorders due to things like infertility. So you can actually have disorders emanating from the fact that a woman is not infertile. You can have disorders emanating from the fact that a woman is going through domestic violence. So, while they may not occur by themselves, they occur because a woman has been exposed to certain things. And of course, many people who have been through trauma, either domestic violence, sexual abuse as a child, physical abuse as a child, are likely to then go on in adulthood to have mood disorders, anxiety disorders, sexual disorders, eating disorders, psychotic disorders, and very interestingly, substance abuse disorders as well. Then, of course, women can also have personality disorders. So it's a whole range depending on who you are seeing, age group, when you are seeing, depending on how much trauma they've been exposed to, why you are seeing at that point. So, but the truth is, women can actually have the whole works of disorders as well.
Okay. I was reading through some articles and I understand that depression is quite on the rise. So probably we'll focus more on depression. A lot of people talk of depression. Like I was even, for instance, years ago, I had a friend. I mean, she had everything going on for her, work, everything. She has a
So
car,
it
nice job,
seems. So it
and
seems.
she disappeared. She just
Mm,
disappeared. I couldn't reach her. And finally, when she reappeared, she had to explain to me that she went through depression. I just couldn't understand it. Like,
yeah.
in fact, she was even admitted into a facility. I just couldn't understand it. So, I mean, depression is quite on the rise
Yeah.
in Nigeria and in most African nations because I think
Yes,
we
it
usually
is.
have a problem on the African continent when it comes to awareness
Yes.
and all of that. So, for depression, I would like you to talk about depression and then explain to us what are the signs. What is depression? Because sometimes we misunderstand it as women. And because we
All
tend
right.
to, I mean, you know, the way we attend to people, we work, we have family, and we tend to just keep quiet on most things. So, what
Yeah.
is depression and how do we identify the triggers, the symptoms, and the signs?
All right. Well, so depression is a mood disorder, and I smile because for many years I had treated people who were depressed until one day, and I wrote an article on that one day. I said, "The day I met depression." And it was important on that day because the person that I was seeing was a celebrity by all standards. And like you, who thought that your life had your friend rather had a life all sorted out, nice car, this, everything is going on. It wasn't the case. So this was somebody who walked into a room and lit up the room when she walked in. But within minutes of having a conversation, she had broken down and started crying. So many times, we see people and we think that they have their lives all sorted out, but many, many times it isn't so. So what is depression simply? Depression is a disorder of mood. And your mood is your subjective feeling state. A disorder of mood in which there is persistent low mood for at least a 2-week period. There is loss of interest in formally pleasurable activities. There's lack of drive, lack of energy, lack of motivation. There are feelings of hopelessness, worthlessness, suicidal ideation, not all the time. There are guilt feelings. The individual may at times start to cry. And then biological functions, which are functions of sleep, sex, and appetite, are also significantly affected. So, all of this are symptoms that you try to look out for when an individual says that they're depressed. But there's also mild, moderate, and severe depression. So for instance, mild depression will just be, oh, low mood, lack of drive. But in those individuals, there's what we call mood reactivity. So for instance, you say to someone who has mild depression, oh, if I gave you 10 million naira, would you be happy? Oh, the person smiles and says, oh, yeah. But of course, once in a while, they feel low. But of course, by the time they start getting to moderate or severe depression, all of that doesn't matter. I mean, let's look at Kate Spade and Anthony Bourdain. They seemed to have their lives all put together, but there was still that emptiness. An emptiness that they could not describe, that they could not even tell anyone how exactly it was that they were feeling. So as the symptoms increase in number, and of course in severity, that's when you move from a mild to moderate and to a severe depression. Of course, the treatment styles are also different. For mild depression, the individual can just go for psychotherapy, talk therapy, and they get better. Very often, that type of depression is reactive. So maybe something happens. They lose someone, they wanted something and they didn't get it. And after a while, you talk to them and they get over it. But in moderate and severe depression, many times, you don't even know what is wrong. The neurotransmitters are just, fluctuating at all times.
Okay.
And for some people,
So
they are unable. Go on, please.
okay, before you go on, I was just going to say that, you've highlighted some of the signs, but I was just going to ask, what are the simple common signs that as women that we can notice that we know that we are going into this? What are the simple common signs? And then I'll take a question by someone now. But just what are the simple common signs that we see that we should take notice of?
Well, so we're all different. And different things will happen to us at different times. So, for instance, I recall that when I had my own baby, so I'll use myself as an example. The energy was low. In fact, for a long time, I kept saying I wanted to write an article titled, "Where Did My Mojo Go?" And I couldn't even get the strength to write it. My energy was low. My mood was low. My motivation was low. I was still able to sleep. I was still able to do a few things. I was still able to function. But I knew that this was not me. Things are just, changed from what it was. I mean, you could call that reactive. So for different people, it may be different things. But for some, it may be as simple as getting up and not being able to leave your bed because there's just no drive to do so. Some people just want to sleep in a dark room all day. Some people just want to turn off their phone and not speak to anybody. Some people just find that, the things that they will do on a normal basis, get up in the morning, cook for this person, cook for the other person. There's no drive to do it. The things that they used to enjoy before, maybe going to church, hanging out with friends, they just find that they want to be by themselves. They just want to live a reclusive life. So to be honest, for different people, it's different things. But quite a number of times, you can actually highlight the core symptoms, which are symptoms of mood, energy, and motivation. Those are the core symptoms. And then all the other symptoms that I spoke about the other time, feelings of hopelessness, worthlessness, suicidal ideations, guilt feelings, crying spells, low mood, low appetite, low sex drive, and then the additional symptoms. It is likely that one or more of these things would have been affected.
I'll take this question by someone now. Let me read it out for you.
All right.
She said, "What of the case when you don't even know you are depressed? I was clinically certified depressed and I was wondering how."
I mean, so I often tell people that I encourage them to read about depression, not because you want to have depression, but because you want to be able to recognize it when it shows up. A few years ago, pre-period, I just noticed that my mood crashed. So from like a 10, it went to a 2. And immediately I was like, no, this is not me. There's something wrong. So many times you'll be able to tell you there's something wrong, but I just can't put my finger on it. There's something wrong. And then after the mood dipped, I also found that I didn't have the energy and, drive to do the things that I would normally do. So ordinarily, I'll be able to play with my kids, make their food, get them ready for school. It started taking a lot of effort. But remember that I said it was pre-period. So immediately the period then came. I had recognized that there was something wrong, and I reached out to friends, and I'm like, guys, I'm not feeling my optimum self. There's something wrong, but I just don't know what it is. But immediately the period came, and the hormones pretty much dropped. The mood lifted. The energy came back. So many times, it's those subtle things. It takes you being able to, first of all, know yourself, and then be able to tell that this thing looks like this, it's likely to be this. So if you don't know what depression looks like, chances are you'd miss it when it swings by. You won't even know that. So you just say, okay, well, this is what it is.
Okay, so before I go into the coping strategies or mechanisms for this, I read an article on the National Institute of Mental Health, and they stated that some women may experience premenstrual disorder. They call it PMDD. I was actually
yeah.
and then I could relate because I was speaking to someone, mental health, we're just talking. The person is in the medical field. And she said it was her own time where she was depressed, but she identified it most especially when she didn't see her period for 2 months. She said she just knew it was a sign. So reading that article, I was like, really? Hormonal changes can also be a sign? I want you to talk about that too, as regards women.
All right. Well, so I mean, hormones pretty much drive everything and anything that we do. And it's the reason why, so for instance, quite a number of women have issues with their thyroid organ, and they don't know, their thyroid gland, and they don't know. So they can actually have a case of hypothyroidism.
What is thyroid gland? Before you move on, just explain.
The thyroid gland is a H-shaped gland by the neck here.
Okay.
So the thyroid gland produces hormones that regulate certain things in the body. So many women, quite a number of women, have fluctuating thyroid hormones and they don't know. So you might actually have a woman that has hypothyroidism, or you have one that has hyperthyroidism. And the endocrinologist will tell you that a woman who has hypothyroidism, and many times doesn't know, is referred to as a lazy woman. Because people just see this woman who doesn't have a drive to do anything. She's not motivated to do anything. Everything else appears to be going on around her, but she's just lazy. She wants to do, but she cannot do. But many times it's because, the thyroid hormone is low. Meanwhile, in hyperthyroidism, they refer to that woman as the angry wife syndrome. So the hormones are raging. So the hormones many times are the T3, T4 hormones. They are way up there. She's unduly irritable. She's aggressive. She gets angry at every opportunity. But chances are it is because the hormones are fluctuating. So usually what happens in a PMDD or a PMS is that because, these things happen in cycles, 28 days, 26 days, the body is aware. And the body is going to let down some hormones just before the period shows up or does not show up. And the hormones then start to cause a lot of fluctuations in body function. So PMDD or PMS, PMDD, premenstrual dysphoric disorder, or the premenstrual syndrome occur a few days before, sometimes during, and after a period. And they are largely symptoms, they're emotional and physical symptoms. So emotional symptoms, the woman just finds out that, either during ovulation, it also happens during ovulation, hormones, estrogen will go up, progesterone can shoot up. And then they just find that they're unduly irritable, they have a low mood, they're tired, they don't feel like eating, they don't feel like going to work, they have pain in certain parts of their body. A lot of these things are under the influence of hormones. And I think it's also important to talk about the fact that because women also undergo a lot of stress, the hormone cortisol, which is a stress hormone, and of course adrenaline, are released a lot into the system. It's okay to be stressed every once in a while, but by the time you find that you are in a chronic state of stress, it just dysregulates everything that is supposed to be working normally in the body. So hormones are extremely powerful, and they can wreak a lot of havoc, especially when they're not in the right place.
Okay. Now that you mentioned stress, I was going to come to stress. We know that most of the complaints from women sometimes are stress, tiredness, and all of that. And I want to talk about stress, anxiety, and loneliness. How do we cope as women with this in our everyday
Okay.
living? How do we?
Okay, well, if you recall when I gave the definition of what mental health was, I said we have to, for you to say that you're mentally healthy, you need to be able to cope with the normal stresses of life. Stress is a normal response to a threat or to a stressor. So your body senses that something is not quite right, sets off a couple of hormones, but if you're able to, take it out well, your body comes back to, size. But what we found is because of the personal, family, environmental expectations of women, they're likely to put themselves more, at a higher level of stress when they compare themselves to men. So even in this lockdown phase, you'd find some women saying, oh, I still have to cook 3 times a day. I have to give this person a bath, apart from giving myself a bath. Some women are still working at home. So while the previous stress was caused by, Lagos traffic or, anywhere in the world where you are, where there's a lot of stress, you find that even the things in your immediate environment can continue to stress you. What we're trying to teach these days is that we need to start looking at stress in a different way. Stress is not always bad. Like I said, stress is normal. But if stress is chronic, and then you view stress as bad for your health, chances are stress will damage your body more than it would have if you actually thought that, well, we're going to get up, we're going to cook, that's normal, and you can cope with it. So when women remember that every time you are in a chronic stress of stress, the hormones, adrenaline, and cortisol are released to a large extent. And when they stay in the body,
Network. I think there's a problem with the network. Let's hold on for a while. Wow. I think there's a problem with the network.
hello? Yeah, so
I can hear you now. It
like I
paused
said,
for a while.
yeah, it did. It paused for a while. So stress would show at every part of our bodies: skin, in our sleep, eating habits, productivity at the workplace, productivity at home, in our relationships, in our interactions with even people. So it's important to be able to recognize stress, what stresses you, and what stresses you can be people, places, or things. And I often always say identify them, and sometimes you may actually need to take a physical walk away from some of those things that you can actually avoid. For loneliness, loneliness is such a big deal right now.
But now,
Can you hear
you
me?
mentioned that stress, you can identify people, thing, or place as
Yes.
being responsible for your stress.
Yes.
Now, what if you can't cut off some of those things? How do you cope? Because if you have something, how do you cope if you can't cut off some things? Oh, network.
I'm here. I can hear
Okay.
you. Yeah.
Oh,
So
okay. It's possible.
if you have someone that you always have to be with, then you then need to learn how to build your own resilience and work on yourself. So for instance, if it's a partner, either in a marriage, if it's somebody at work, the person you then have to work on is yourself and your response to that person, which is why then emotional intelligence will come in. It's the ability, first of all, self-awareness and self-regulation before you start talking about managing other people. It's you being able to deal with yourself, knowing yourself, your worth, your strengths, your weaknesses, your opportunities, your threats, and then being able to regulate your emotions even in the face of stress. So you can actually, be with people who would normally stress you, but being able to keep at peace with yourself, know yourself, but also be able to regulate your responses to them, even when it is obvious that whatever it is that they're doing is trying to stress you out.
Okay. I'll take this question before we go on.
Okay.
What do you advise if you feel like no one understands your rationale, decision, and causing stress or are afraid to talk to someone about your feelings?
I'll say talk to a therapist. And I say talk to a therapist because if you feel this way already, then you need someone who will not judge you. You need someone who would listen to you, listen to your experiences, understand that whatever it is that you're saying is valid, and will not, minimize them just because they think that, oh, you're a bother. And that's what professional therapy is for. Speak to a therapist. It's a no judgment space. We would listen to you when you do come in, and whatever concerns you have, you can talk about that with your therapist. People are likely to look at you and say, oh, shake it off. It is well, push it off. But a therapist, the place of therapy is a non-judgmental zone where your concerns are valid and you will be listened to.
Okay. So I once read one of your articles or something you wrote about people often react negatively or respond negatively to some of this mental health disorders. For instance, drinking alcohol, having sexual relationship, and just doing things they are not supposed to do. So what is the right response to some of those things you've mentioned?
All right. So, if I get you right, it's in response to coping, and those are coping mechanisms.
Mechanism, yes.
So when life throws stress at us, overwhelming stress, or in the midst of a crisis, like right now, we're in the midst of the COVID-19 pandemic. And interestingly, I must say that there are certain people at this point who, while this big crisis is going on, they're going through their own crisis. So it's important to know that we will all react and respond differently and also try to cope. So even the use of alcohol, the use of substances of abuse is a form of coping. But there are two major types of coping, and they are the adaptive and the maladaptive ways of coping. The maladaptive ways of coping are some of the things you've said. So for instance, I've had clients who over the years, maybe in their teenage years or even in their adult years, were raped, sexually abused or sexually assaulted. And in a bid to cope, they self-harm. They cut themselves, either at wrists or places where other people can't see, using either knives or as little as a razor. Some people actually inflict nail injury on themselves just because they want to let out the pain. They want to see themselves bleed. And because alcohol is a generally acceptable substance, it's affordable, it's everywhere around us, people use it. But a lot of people also misuse alcohol. And you misuse alcohol when you can't control your use. You've developed tolerance, and tolerance means you need to keep taking more every time just to achieve the initial desired effect. You start to abuse alcohol when everything else is falling apart in your life, but you want to keep chasing alcohol. Family is falling apart, work is falling apart, but alcohol is the most important. Abuse of alcohol when you've gotten into trouble a lot of times because of your use, either because you were found drunk driving or you crashed your car so that's when you start to say that people are using alcohol rather maladaptively. Then of course, other substances of abuse, we find that people are turning to other substances of abuse, including prescription medication. So you hear people go to the pharmacy, they want to grab codeine, they want to grab tramadol, pentazocine. Even people that are not doctors these days are injecting themselves with, prescription medication. And then before you then talk about, cannabis, cocaine, crack cocaine, to mention but a few. So those are maladaptive ways of coping. The adaptive ways of coping would include things like journaling, writing down your feelings, the things that are bothering you. When you do that, you could also vent. So talking in a constructive manner to someone, either a loved one or a friend who has your sincere and genuine, concerns at heart. But the highest rate of that would be the fact that you find a therapist to talk to, especially when the feelings become rather overwhelming. So what we advise most times is that people explore adaptive ways of coping, because of course both of them are coping measures, but some are adaptive while some are maladaptive.
Okay. Okay, so I would like to talk about postpartum depression. I actually have someone that actually sent in that question that she would like you to talk about postpartum depression. Can we talk
Okay.
about
Yes, we can. So postpartum, the postpartum period many times refers to the time after a child has been born to 6 months after. So that's the postpartum period. And, it's those times that they always say, oh, come to the clinic, maybe in 6 weeks, let's see you and the baby. Come to the clinic at 6 months, let's see you and the baby. So usually, in the first few weeks, a week or two, some people have what is called the baby blues. And that's, as baby blues associated mood swings, anxiety, especially if, one, the woman is a first-time mother, two, had no idea of what was going to go on at delivery, or three, has no support whatsoever pre-pregnancy, intra-pregnancy, and post-pregnancy. Then sometimes, of course, if the delivery has also been quite traumatic, either that, oh, they were in labor for a long time, or maybe they had tears, or they had to undergo an emergency cesarean section, chances are, these are some of the things that increase the risk of having either a baby blues or postpartum depression. And then postpartum depression is different from the baby blues, because while the baby blues will come on in the first 2 weeks and last for a few days and eventually disappear, postpartum depression is likely to last longer. So all the symptoms that we saw in baby blues are some of the ones that we would see in postpartum depression, except that they last longer and are likely to interfere with the ability to take care of yourself, the baby, and attend to daily tasks, things that you would normally have been able to do previously. And so some of the symptoms of a postpartum depression include things like depressed mood, excessive crying, there's difficulty bonding with the baby, you want to withdraw from your family and friends, you're unable to eat well, or you're eating more than normal, you're not sleeping well, you feel fatigued and overwhelming feeling of fatigue, you have reduced interest. If you can see quite clearly,
it
it
still
sounds like
goes back to
symptoms of the depression that I said before. There's hopelessness, worthlessness, difficulty concentrating, severe anxiety, difficulty paying attention, recurrent thoughts of death, thoughts of harming yourself and the baby. So a few years ago there was this story about a woman who had a set of twins, and on the day of the naming ceremony, it was in Ibadan, she took them to a bridge in Ibadan and dropped them in the water. Amazingly, she didn't kill herself, but chances are she was having a postpartum depression or a postpartum psychosis going on at the time. So that's basically what postpartum depression is. It occurs in the period following delivery, a few weeks after to about 6 months, and the risk factors that I just said earlier are likely to be present in the woman. And of course, she would have those symptoms when postpartum depression occurs. And of course,
so
she would also find it difficult to cater to herself, her baby, or carry out daily tasks that she would normally have been able to do without so much effort.
so what do you advise women that goes through this, that have noticed this, or that have seen the signs before? What do you advise? Because
Oh, also because go
our
on, go on.
society is, it's usually like pray and all of that. So what do you advise women that go through this?
Well, so because I'm talking to women in general, and I want to believe that there's some women on this platform right now that have not even gotten married or
Married.
don't even have a baby yet.
Mm-hmm.
I think, first of all, I would say start from yourself. Know yourself. If at present you're having any issues that you don't seem to understand, please reach out and get help. Chances are, and I want to talk to them first because I wanted to talk about the fact that you need to be intentional about the partner that you end up with. Bear in mind that I said one of the risk factors is a single mother who has no financial or emotional support from a partner or even the family. Those are some of the things that put women at risk of depression. So ensure that before you even get hooked or decide to settle down with someone, you are in a good place yourself, mentally and in all wise. You're not doing this because you just want to be with somebody or because you want somebody to make you feel loved and accepted. You need to be in a good place yourself. You need to be well grounded. You need to love yourself for who you are. And if you have issues, it's important to reach out. Of course, when the woman then gets pregnant, it's important to know herself, know her body, go to the doctor as soon as possible, register for antenatal. If you have any symptoms, any worrying symptoms, things you don't understand, educate yourself. Read more, talk to your doctor, ask a lot of questions. And if you find that anything is stressing you and it's not making you do well, talk to your doctor so that you can get a sick off from work.
Okay.
If you did, if you're deliberate about your kind of relationships, you don't have to beg your partner to help you around the house. Your partner would support you, would be there for you, financially, emotionally, physically, and all of those things give you a form of reassurance so that, you are in a better place. If at any point in the pregnancy, you have feelings of low mood, please talk to your doctor. The truth is that pregnancy it's unpredictable, and for some, while it is seamless in some women, it's also not seamless in some others. For some, it is quite traumatic. Some women are on bed rest from the time they find out that they're pregnant till the end of the pregnancy. Pregnancy is different for everyone. Understand the struggles that you're going through and reach out for help. There's nothing wrong. It's said that when we're under a lot of stress, we should actually reach out for help. When you reach out, you're likely to have a lot of oxytocin secreted in your body. And oxytocin is a, fairly good hormone. It's called the cuddle hormone. You need to reach out to people, talk to people. If there's depression pre-birth of the baby, we should start treating it. If the birth was traumatic, and it's important to talk to your doctor about what your birth options are. So some women, go through traumatic birth experiences just because they're trying to prove a point. They want to have vaginal delivery at all costs. Meanwhile, your doctor has told you this child is going to come like this. Why don't we do a C-section? Ensure that you have informed decisions. You make informed decisions that would make the entire process seamless for you. Pregnancy is tough. Delivery is tough. And then now taking care of a baby who is likely not to want to stop crying is also quite difficult. You need all the love, encouragement, and support that you can get.
Okay. I like the fact that you answered that question, relating it to the relationship that we build. It is very, very important. So I like that fact. But however, can you please tell our women that identifying these things and seeing these signs doesn't mean they are mad? And it doesn't mean that it is a death sentence. I mean, we're struggling with stigmatization. As a continent in Africa, everything is too, the way we just suck it all in. Can you please just tell them, no, it is not the end of life. And like we had in our last session, the brain is an important organ too. It also works with the other organs in the body to function appropriately. So can you please tell us that, no, this thing is like you have malaria, if I can say that.
All right. Well, so it's fantastic that we're having these conversations in May, because May is the Mental Health Awareness Month. And and the theme for this year is kindness. And we all need to be kind even with the words that we speak. The words that we speak and use to describe other people who may have challenges. And they're called challenges because, like I would say to most of my patients, where you are sitting, I can be sitting there. What differentiates us at this time is the time and the experiences. There's no one that is immune from a brain disorder, from a mental health disorder. Just because we haven't had it yet does not mean that we can't have it. And it's not a curse. It's just the reality. There's nothing wrong with not being okay. It's okay not to be okay. However, what is not okay is you not getting help when you find that things are wrong. About 2 weeks ago, a colleague reached out to me and said one of our relatives needed to see a therapist. And I said, oh, fine, let them come in. But about a week later, she reached out and said, oh, the family members said that, oh, because of stigma and discrimination, and they don't want people to use it against him in future. And I told her, I said, are you telling me that these people will take a poor quality of health over perception by the populace? And I felt really sad about it, because while these things may appear little, they affect so much. They affect relationships. They affect your own care of yourself. They affect your overall quality of life. And it is for this reason that, we need to take ourselves seriously. If there's something you don't understand about your body, either your brain or your physical health, reach out to a professional who may be able to tell you better what to do.
Okay. So in Nigeria, I'll use Nigeria as an example. What are we currently doing to encourage women to seek help? What are we currently doing to, stop the stigmatization? I know that we have very few hospitals that focuses on mental health. Like, I know that we have probably 8 federal psychiatric hospitals. So what are we doing in Nigeria to help women seek help?
All right, well, so tonight we're doing this. But beyond doing this is that, well, the drive it's much better than it was a long time ago. And this, for this night, I actually want to give kudos to the people that we call the user groups. The people who have been raped, who have had depression, and have decided to turn their pain into purpose. In fact, they do a lot more work than a lot of us do. And that's because a lot of us are then saddled with the responsibility to take care of other patients. A lot of this, young people are women. So for instance, I would mention an Ayodeji who owns the Stand to End Rape. I would mention Awa Ojefo. I would mention, a young lady, Linda. These people are at the forefront. They're talking about it. They're trying to normalize the conversations. So a lot of this is being done. While I would say that, a lot of attention on like abroad is not given to, like women's mental health. But the truth is, it's not where it was before. Things are changing. People can walk into the psychiatric hospital now and say, oh, I haven't been sleeping well and I decided to come. I mean, a few years ago, I would look at you and say, oh, they actually didn't force you here. You came by yourself because you couldn't sleep. So we're seeing a lot more progress. A lot of people are talking more. A lot of people are seeking help. A lot of people are, crying out because their needs are not being met. But the truth is, a lot of effort is going on. And I mean, at the end of today, we also hope that we're able to encourage a few people to be advocates, to join in on the cause about, mental health issues.
You can drop your questions, everyone. We have 10 minutes left. Before then, somebody actually said, is Dr. Abiri, let me look at it. I hope she's not expensive, just in case. And somebody asked, is Dr. Abiri based, where is she based? I think that's a question like that. So if you have any other question, please drop your questions. So is Dr. Abiri expensive and where are you based?
Dr. Abiri is affordable. Dr. Abiri is affordable. Where am I based? I feel like the world is now a global village. I mean, we're having this conversation. I'm in Lagos. You're far away. And, because of the COVID-19 pandemic, a lot of telemedicine, what we will call telepsychiatry, is also ongoing. I'm based in Lagos, but even if I'm not in your town and you want to see a therapist, I can always recommend a good hand to see you wherever you are.
Okay. So from what you said about advocacy and the awareness that is going on by individual, how do you see the future of mental health in Nigeria? I mean, because, like when I Google, I could see in the US, I could see 1 in 5 women, but it was difficult to see the stats for countries in Africa and all of that. Most of the things I saw are like from 5 years ago, 6 years ago. So what would you say about that? How do you see the future of mental health? Do you think people will be willing to see it as something that's medical rather than spiritual?
Well, so I mean, it's a tough conversation to have. And I would say tough because at present, there are less than 200 psychiatrists in Nigeria.
Yes.
A lot of my colleagues have jumped ship. And they're expecting me
For
to
a
jump ship.
population of 200 million people.
Yeah, so it's one psychiatrist to 1 million people. People don't know it's that bad. So people are encouraging me to jump ship. Then, so for instance, you also want to look at the places where we work, the environments that we work in. We would have expected that by 2020, mental health care would be free, or at least highly subsidized, so that people, because for a condition that is chronic and lifelong, we find that people are paying out of pocket. So you go to hospital sometimes and people are going around and they're saying, doctor, please, can you help me raise 1,000 naira? It's for my medications. It's a difficult situation. Poverty doesn't help. Ignorance doesn't help. Our cultural and religious beliefs over the years have not helped. And of course, the fact that people also have coexisting diseases, either physical or extra mental, problems, have also not helped. The homes that people also grow up in and the trauma that they've been exposed to at different times of their lives. So either physical, emotional, a lot of which goes on around here and we rarely talk about, sexual trauma, neglect, all of those things make the dynamics quite difficult. Although I would say to you, a lot of work is ongoing. It's not, people were not having these open conversations before. But now you're finding people have these conversations, and then you're actually having people listen in on these conversations because they want to get help. So I think the future will be great, but of course, the future depends on what we do in the present and what we are able to make of it going forward. That's what I would say.
Okay, probably final question, probably. Would you say people can you be born with a mental health disorder?
Okay, well, so that will then be talking about heredity.
Yes.
And so mental health disorders can be gotten either we say that the causation is either biological, psychological, or social. Family studies, we call them genetic studies in general. Family studies, twin studies, adoption studies have shown that some types of mental illnesses are likely, if they happen already in a particular member of the family, chances are they can happen in other members of the family. And the list is endless. Depression, bipolar affective disorder, schizophrenia, and interestingly, even substance abuse problems have found a basis in genetics. So if one parent is affected, it would increase the chance of a child or two children having it. Yes, so some disorders can be hereditary, but it's also important to note that not everyone that comes from a family where there's a disorder may come down with that disorder. That's where you then need, all the dynamics to be in place. Either, or you need an added trauma, or you need use of substance to wake up the disorder. Some people are actually able to go through life and not have the disorder that a previous family member had.
Okay, someone just asked, can depression be network or the network? Let's just hold on a little. Let me see.
Sorry.
Okay, someone just asked, can depression be completely cured or just managed?
So earlier on, when we started, we talked about the types of depression: mild, moderate, or severe.
Okay.
Then there's depression that is reactive. Depression that happens because there's a loss. Depression that happens because there's an unfulfilled expectation. Usually, if you're able to handle these things early and you handle them professionally, they may go away. However, the other type of depression that now happens because of fluctuations in neurotransmitters of serotonin and the others may be more difficult to manage. And that type of depression is likely to last longer, which is why when we talk about treatment or management, we talk about the fact that we do what is called a multidisciplinary approach, and that we individualize the care of each individual. So multidisciplinary, psychiatrist, psychologist, occupational therapist, depending on the specialist you need to see, and then individualized to meet the specific needs of the individual. So what's wrong with A and what triggered their depression may not be what's wrong with B, may not be what's wrong with C. For somebody, it may be sexual abuse. For somebody, it may be emotional abuse. For somebody, it may be because a partner left them. So at the end of the day, it's being able to individualize the clients that comes for treatment and manage them effectively.
Oh, okay. Okay, so finally, we have less than 5 minutes. I think about 3 minutes. Finally, what are your final words to women that are listening to you presently when it comes to taking charge and taking care of their mental health?
Well, so what I would say to women is know yourself. There's a quote that I like to say that God has entrusted you with the care of yourself. Before you think about taking care of anybody else, take care of yourself. Know yourself. Have a high index of suspicion about things going on around you. Develop yourself. Love yourself. I often say that if you don't love yourself, why should anybody else love you?
Sure.
Empower yourself, educate yourself, reach out to people when you need help. But most importantly, ensure that you are a grounded person. All of us are a work in progress. Nobody is perfect. Well, it's progress, not perfection. And every day we're trying to do something to be better than who we were yesterday. Do something. Time does not heal all wounds. You need to put in the effort. If you've lost someone, if you've been assaulted, if there's something holding you back that you can't deal with effectively by yourself, I encourage you to reach out. Reach out and get the much needed help. Because if you don't get that help, you would compound the issues that you currently have, allow someone else take advantage of you, and then unfortunately affect the generation that you're going to bring, that is coming ahead of you negatively as well. So women, be in charge. Take good care of yourselves because no one else will take care of you like you should.
Thank you so much, Dr. Abiri. Thank you for joining me today. I am most appreciative of this. Thank you so much. Thank you
You're
so
welcome.
much.
You're
All right,
welcome.
bye.
All right, then bye.
Thank you. Yes. Thank you so much, everyone. It's like 2 minutes. Instagram will soon start